Okay, we're going to move on now and talk about infections and inflammatory conditions. What can be done for Lyme disease? There was a study where they found that when someone was vitamin A deficient, it led to an earlier and more severe arthritis from Borrelia infection. And Borrelia is the organism that causes Lyme disease. One of the things that a lot of researchers have found, there's more than one bacteria that you can pick up from ticks. There's actually a number of different bacteria, and all of them can create symptoms that can kind of mimic Lyme disease. But the important point here is that vitamin A is critically important for immune function, and if someone is deficient in that nutrient, then the repercussions of any kind of infection. They found in Africa if they gave children large doses of vitamin A, dramatically protected them from measles. They would have very high death rates until they began giving the children vitamin A. And vitamin A is a nutrient that's not really widely available in the diet. The only foods that have preformed vitamin A are liver, eggs, cod liver oil. That's pretty much it. There's not a lot of food sources of those things. Carotenoids can be converted to vitamin A. And a lot of times when you look at supplements, you will see vitamin A, but it's actually carotenoids that are in the product. But the problem there is that there's certain conditions, such as diabetes, where people cannot convert the carotenoids to vitamin A. And they actually do much better with a preformed vitamin A supplement. And one of those conditions easily could be Lyme disease, and others diabetes. Dr. Mark Altschul found vitamin A deficiency very, very common in diabetes. And one of the symptoms of vitamin A deficiency is a real heavy callousing on the bottom of the foot. And so he would look for that, and if he saw that heavy callousing in the foot, he immediately began to examine his patients to see if they were diabetic, because that blockage in the utilization of vitamin A was so common in diabetes. That's an important thing to know, because about 11% of the American population is diabetic, and a lot more people are headed that way. Another study that was done with Lyme disease is they found that supplementation prevented the development of arthritis when animals were infected with Borrelia. Vitamin D is the precursor to something called cathelicidin, which is an antimicrobial peptide. I think I talked about that yesterday. So it's very protective against a wide range of infectious organisms. The usual treatment is doxycycline. There's been a lot of difficulty with finding antibiotics that will actually kill the Lyme organism and make people feel better. There was a paper that was written by Dr. Lynn Hanshu where she found that a silver product was very effective in killing Borrelia. So I just throw that out for your interest.